Collecting, cleaning and using data. So next part, which I think is probably one of the most important parts of all of this database management. So as we said before, good data is accurate data. But how do you actually make sure that you do have that good data and that accurate data? Check at every touch. So every time the phone rings, every time someone makes an appointment, check that you do have their mobile number, check that you have their email address and make sure that it is correct. Also ask them how do they want to be communicated to. Some people do get a little bit funny about email or even via the phone just because they're not sure of who's going to be around them when they're receiving it. And also their goals. What are their goals? How are they actually going to get there? And what happens when they do achieve these goals? So there's lots of information that you can be capturing around individuals and around your potential and your existing patients. The data responsibilities really are about collecting consistent data. So making sure that all data that you do collect is consistent, whether it is online or in the clinic. It's about cleaning the data, making sure that it is accurate. We saw in the National Privacy Policy or principles that they have a requirement for you to make sure that your data is accurate. So the clean and the refresh are really important phases for you to be making sure that they are kept into the loop and included as part of your ongoing procedure for database management. And then use the data. So making sure that the data you collect is data that you use. You don't need a lot of data, but make sure that data you are getting is the stuff that is relevant for you and your communications. The inquiry forms should gather as much information as necessary. Not any more, but as necessary. So this would be a great place for you to understand what the goal weight is, so that at least you can make sure that you are tailoring a solution and a system for them. The other thing, and we did touch on this with the National Privacy Policy and principles, is the unique identifier. So this unique identifier is also known as a primary key, and every individual record has a primary key, but it needs to be unique for every single person. Clean data is basically the foundation for any database management. If you don't have clean data, you can't be guaranteed that any of the communications that you're sending out are actually getting through to where they need to be. To make sure that you do have good, clean data, your data should be refreshed on a 6-monthly process. So every 6 months, do a cleanse and make sure that the data in there is actually up to date and current. To make sure that your data is actually clean and accurate, there are a couple of ways that you can be refreshing your data. An annualised incentivised based survey, so whether this is through mail or even an online system, just so that their data can be accurate and can be cleansed, as well as outbound client satisfaction calls, so picking up the phone just to make sure and check in to see how the patients are doing with their goals, or to make sure that they are actually adjusting to having their procedure or their surgeries. So every patient contact should check that the records the surgery have are the most up to date, and by doing this it'll mean that that refresh process is a lot easier to maintain and manage. We've covered the data in regards to the messaging, and we have looked at the messaging initially, but if we have a look, and again just looking at a typical cycle and a typical journey that a patient has with a clinic, the potential patient may come in, they may look at why surgery, what others have experienced, about the surgeon and the clinic. A lot of this information is actually captured on your website, and you can cut it down and you can add photos to it so that it feels like it is actually tailored for those people. When someone is a new patient or when they've agreed to the procedure, it is a reminder that they are actually going to have their procedure on this date. Giving them information about what to expect, some helpful tips, some other patient frequently asked questions, some of the content that you know that when people pick up the phone, these are the things that they are constantly asking, or even when they come into the clinic, this is what they want to know. First adjustment, exactly the same things, is reminder, what to expect, what to feel, what to eat, some helpful tips, and again some patient frequently asked questions. Same with the second adjustment, it's exactly the same as this. Also, people like to feel at ease and know that other people have gone through similar things. So anytime that you can actually refer it back to a particular patient or share that particular patient's experience, the more closely tied they feel to the clinic and also to the experiences that they're having. And same with the third adjustment. So the difference between the second and the third is basically the information that you guys will have around what patients and potential, or what patients are actually asking for and requesting when they're in that process.